We have Dr. Rahul and Dr. Mayank with us. Well, today we're going to talk about stone management. And when we are talking about the same, I would start with you. A very small and very simple question for our viewers. What do you think the number of cases of stone are actually increasing and at a very constant rate? So, what is could be the reason behind it?
Hello everyone. The reason for increase in incidence of stone formation is largely attributed to our diet and our water intake. Primarily it is the water intake. The reduced water intake leads to dehydration inside the kidney and crystallization of the small stones.
Okay.
So along with it, other risks factors. Other than this, the other risk factors are increase in uric acid because of the diet, increased protein intake, and thyroid in some patients. So these are primarily the risk factors, and increased salt intake, which is largely attributed to the dietary habits, increased junk food intake. These all lead to stone formation.
True. Well, Dr. Mayank would like to know from you what could be the symptom when a person can get an idea that I might be having a stone and I should reach out for a doctor.
Right. So, a person, if he or she is having some stone, they may face an acute pain in the abdomen. Usually the pain is at the back on the sides. Okay, that is for a renal colic. Sometimes this pain radiates from back to front. So that, and it can be very severe. That like in just a normal way we can say it's the worst pain a person can experience. So that is probably that there is some stone in the kidney which has passed down and has reached the ureter. Ureter is the tube which connects the kidney to the bladder. So if the stone is stuck in the ureter, such kind of pain can happen, and it is something like, as I told you, it's the worst kind of pain anyone can experience. So this is the ureteric colic. And besides that, they can also have difficulty in sudden onset difficulty in passing urine, or some burning sensation, or some pain while passing urine if the stone is down. Even on the lower part of the ureter, they can compress the urethra, the urinary tube, and that can also cause similar symptoms.
All right. Well, Dr. Rahul would like to know what are the precaution a patient can take while he has a stone, or maybe he has recovered and he is looking forward to avoid the recurrent stones. Yeah.
So what we suggest to our patients is increase your water intake.
Okay.
What the water intake should be as much that he can avoid at least 2.5 liters of urine.
Okay.
So it could be 3.5 liters to 3 liters for each patient. So increasing your water intake is the most important cause. Second, reducing excess salt in your diet.
Okay.
These are the two primarily things which can be controlled by a patient. Rest all increasing oxalate consumption. Oxalate is present in most of the green leafy vegetables, inside coffee, beverages. So avoiding oxalate in patients who are having recurrent stones. Third important thing, control your diabetes, uric acid levels, and thyroid. These are the other three things which prevent stone formation. So this is what we advise to our patients. And if you are having recurrent stone, get yourself evaluated. Your metabolic evaluation should be done.
Yeah.
We evaluate them and we know what is the risk factor in each and every patient. That's how we tell them.
Well, when we are talking about water, should a binge drinking would work, or maybe we have our regular intervals?
Yeah, you have to take water in regular interval. Binge drinking doesn't help much because your kidneys have to be hydrated at each and every moment.
Because there are people who will like, I'll drink a liter and then I'll drink at night a liter.
That doesn't help. In between, your kidneys undergoing through dehydration process, so that doesn't help. It leads to more of crystallization of the stones.
So, Doctor, I would like to ask you that there are a lot of myths and misconceptions about the kidney stones. Would you like to burst any of them? Because there were patients, I mean, they could come to you and they say, ki, if I would do this, the stone might pass away. There are misconceptions with all the patients.
Right. So, like in our practice, we find many patients who have got very big stones in the kidney, and they go for all sorts of some treatment, which is not effective. In fact, they are going to other doctors or other form of therapies, And basically, what is the problem that if the treatment of the stone will depend upon the location of the stone and the size of the stone. So sometimes the stone are big and that can cause some obstruction in the passage of urine, and that itself can cause back pressure changes in the kidney, and which may even like leads to loss of kidney. So many patients neglect this thing and ultimately end up having the non-functioning kidney. So basically, if a person has got such certain symptoms, they should immediately seek a urologist's opinion, so that we can like investigate and find the location of the stone, the size of the stone, and offer treatment according to that. Because the treatment of stone varies from conservative, that means just water, few medicine, to surgeries, and like there are various kinds of surgeries, and it also depends on like what modalities, lots of modalities, like we can give some shock waves to the kidney from outside that can break the stone, and that they can pass in urine, or some intervention, put in a camera and operate.
So Dr. Rahul would like to know, what do you think is going to be the next breakthrough when it comes to kidney stone domain?
What breakthrough we, since it's a very common problem we all have, having medicines or any kind of treatment which reduces the recurrence rate will largely help in stone formation, we feel.
If there is a patient who is very late and like he's at the very severe condition, now he's coming to your place, then how you do the management thing?
See, if we evaluate the functions of the kidney, if the kidney has become largely non-functional, then there is no other option except removal of the kidney, which is, for the patient point of view, it is very gruesome thing to be happen, a stone leading to non-functioning kidney. But unfortunately, it is very common in our country, and people neglect their, like Mayank said, people neglect their symptoms and they largely present at a very late stage. So, but it should not be happening. So,
you should be suggesting that as soon as you get to know that you have a stone, you have to reach out for it.
Evaluated. Yes.
Yeah. Thank you so much for giving your valuable. Varsha Singh.
Varsha. Thank you, Varsha.
Thank you
for having us.